me about the foot and ankle speciality.
The foot and ankle, though it seems like one structure, it really consists of about 20 odd joints, and they all work in a complex, synchronous way. And if there's one problem in a joint, it affects the others in a chain reaction, and they don't function well as well. So it's never easy to find a solution, and it's also as sensitive as the hand, yet you can't rest it. You got to walk, even if it is just a few feet, using the feet as paddles. So patients ought to understand that there might not always be a quick fix solution, but we'll get there in the end.
Tell me about the foot and ankle team.
We have three very experienced and highly qualified consultants. Apart from myself, we have Mr. Maida and Mr. McKenzie. We have two very experienced podiatrists, Rob Cox and Louise Bushell. And we have an international fellow who is doing a foot and ankle fellowship at any time. And we also have a British trainee registrar.
How is the Royal Orthopaedic Hospital different from any other NHS hospital?
Because we are a specialist orthopedic hospital, we are able to offer exclusive clinics within foot and ankle, specialist clinics. For instance, we are the only hospital to have children's foot and ankle clinic in the whole region. And basically, we have two consultants, Mr. McKenzie and myself, having clinics which attend only to children's problems in foot and ankle. And then we also have a heel pain clinic run by the podiatrist. And here it's a one-stop shop where GPs can refer heel pain cases. You can get shockwave treatment, you can get injections, you can get insoles and exercises, all prescribed at one clinic. And we also have a complex case clinic where we have all the three consultants sitting looking at patients who have been referred from elsewhere with multiple failed surgeries. So you get the combined experience of all three consultants and the podiatrist being given to the patient. So these services are not available at any other hospital in the region.
How important is your pioneering work?
We are always at the cutting edge of technology, and not only do we innovate, but we evaluate new techniques and products. And each one of us, three surgeons, have a subspecialty interest. Mr. Maida does a lot of keyhole surgery for bunions, and he also does complex ankle replacements and revision ankle replacements. Mr. McKenzie specializes in doing arthroscopic surgery in small joints, that's using a small camera and operating with keyhole instrumentation. And I have a special interest in toe replacement and also minimally invasive surgery for adults and children with flat feet.
So what message would you have for a potential patient who may have a foot or ankle injury?
Well, if you come to the ROH, you can be assured whether the problem is small or complex, that you'll have a world-class service and the best expertise that's available offered to you. And in addition, you'll have a first-class team which will care for you and put you at the center of the focus and listen to everything that you have to say.